What I'm here to talk about is your medicines that you're using. I'm going to explain why you need your medicines, how the medication works, how to take medication correctly, and any side effects that you might want to know about your medicines. The function of the lung is to transfer oxygen from the air into your body, and it also expels the carbon dioxide that your body produces and it releases that into the air again. The airways consist of what you could describe as tubes or pipes that start at the mouth and the nose and they go down deep into the lungs. The deeper into the lungs they go, the narrower the pipes become. And at the very end, in the base of your lung, is where oxygen is transferred into your blood system. In COPD, there is a combination of damaged lung tissue, inflammation, excessive mucus production, and narrowing of the airways. And together, this ends up reducing the amount of air and oxygen that we can get into our body. And the symptoms associated with this are breathlessness, coughing, and an increased risk of getting a chest infection. Now, there's no cure for COPD, and the biggest thing that you could do to change the progression of the disease is to stop smoking. So the medication focus mainly on reducing your symptoms and complications that result of the disease. It doesn't actually modify the rate that your lung function declines. So the smooth muscle controls how much air and therefore oxygen gets into the body. Also in the airways, there's the mucus or phlegm, and the function of that usually is to warm and moisturise the air we breathe so that it's not irritating on the lungs, and also defends the lung against foreign objects or bacteria that you might inhale. So what medication actually does, different medicines work in different ways. So some reduce the symptoms of the cough and breathlessness. They can improve your general well-being and quality of life. Reduce the need for admission to hospital, improve exercise tolerance, which means you can go about your daily activities better, and reduce the number and severity of exacerbations that you may have. They do this in different ways by opening up the airways, reducing the mucus production in the lungs. They help clear the mucus from the lungs. They can reduce inflammation in the lungs and also kill bacteria to clear the infection. The reason that most of the medicines in COPD are inhaled medication means that the medicine is delivered directly to the site where you want it to work. And this also helps to reduce any side effects associated with normal medication taking. If you take tablets, for example, the medicine enters the blood system and it increases your chance of having side effects. So there are different types of inhalers that I'll talk about. The first medicine is called short-acting bronchodilator, and there are different types. One type are beta agonists. It's called a beta agonist because of the site that it acts on in the lung. Examples of this would be Ventolin or Bricanyl, and if anybody's on Combivent nebs, they're getting the Ventolin or salbutamol. These inhalers are generally pastorally described as blue inhalers or reliever inhalers. They're very kind of fast acting, so they relieve the breathlessness associated with COPD. And by opening up the airways, they help also to improve the clearance of mucus from the airways. So they can be used as needed to relieve symptoms, or they can be used regularly 4 times a day to help keep the airways open. This kind of inhaler, if you're out and about, it's always handy to make sure you've got one on you in case you get breathless and need to use it, and also have a spare handy in the house so that you don't run out. Side effects of these medicines are commonly like palpitations or a racing heart, tremor, shaking in the hands, headache or restlessness. So another type of short-acting bronchodilator are the antimuscarinics or muscarinic antagonists. This is the only one that we use here is the Atrovent or ipratropium. This is the second drug in the Combivent nebs. So a lot of people do use Combivent nebs. So again, you're receiving this drug in that. It also helps open up the airways, but just acts at a different site. It relaxes the muscles in the airways, allowing more air to enter the airways, and also it blocks the effect of irritants on the lungs that can cause chest tightness. So it's also known to reduce mucus production, which can be helpful where your condition generally produces a lot more mucus than normal. Again, this can be inhaled as needed or regularly 4 times a day to help open up the airways. This particular drug isn't as fast acting as the Ventolin. It may take 15 or 30 minutes to really feel the effect from it, and the effect lasts for about 3 to 5 hours. So this kind of medicine actually can cause dry mouth, nausea, headache and blurred vision, but dry mouth is generally the most common side effect that people will complain of. If you're nebulizing the Combivent, it's important to wear a well-fitting mask or ideally a mouthpiece, and that reduces exposure of the eyes to the drug. If too much of the drug is released and affects the eyes, it can lead to glaucoma. And the other thing actually about mouthpieces nowadays, when you're nebulizing medicines, it's thought that if you use a mouthpiece instead of a mask, it may help get the drug deeper into the lungs and it would work better. Sometimes if you're too out of breath or just unable to use the mouthpiece, the mask is used. Now, I'll go on to the long-acting inhalers now. The main advantage of these is that they are what they say, they're longer acting, which means that they don't need to be used as frequently. That helps to improve compliance with medicines, and they're also thought to be more effective that way. They're not used for the immediate relief of symptoms though, so it's important to know which ones you can take when you feel breathless and which ones you take regularly every day. The first type is the beta agonists again. 2 of the drugs, Ceravent and Oxys, are the older ones. The Ceravent, or salmeterol, is the drug name. It's in the Seretide. So anyone using a Seretide inhaler is taking salmeterol. Anyone using a Symbicort inhaler is using formoterol. And like Ventolin and Bricanyl, they act in the same place, but they only have a longer duration. So they hang around in the lung longer, and that's why you only need to take them twice a day. Similar types of side effects, but just maybe not as common with these inhalers as the Ventolin. Now, Onbrez is a relatively new inhaler. It's called Indacaterol, and it's one of the drugs that's in the Ultibro inhaler as well. That's like a combination inhaler I'll talk about later. So it actually only has to be taken once a day, but again, it has to be taken regularly every day to get the best effect from it. Now, the side effects of the Onbrez are, it is associated with all the other side effects I've mentioned, but they're not as common, and the most common reported side effect for this inhaler would be like cold-like symptoms, like that of an upper viral infection, like cough, sneezing, runny nose, sinusitis and headache. Now, the other type of long-acting bronchodilator, when I say bronchodilator, I didn't explain, it's just a medicine that helps open up the airways, are the antimuscarinics, or long-acting muscarinic antagonists. The original one that was the only one available up until recently was Spiriva, that's tiotropium. Now we have 2 more, one's Seebri and one's Eclira. So again, they're all acting at the same place. They have different durations of action. The Spiriva is used once a day, as is the Seebri, and the Eclira is twice a day. Again, they're used to prevent airway tightening. Ultibro is a combination of the 2 different types of long-acting bronchodilator. It's only used once daily, very convenient for patients. It's been shown to improve lung function, exercise capacity, breathlessness, health status, and decreases exacerbation rate. These are all things that studies nowadays look at, they're the outcomes that they want to see from trials of inhaled medicines. They improve compliance because they're so convenient. You don't have to use them multiple times per day. Now, there's been a lot of movement, I guess, lately in the development of new inhalers and new drugs, and there may be more options, soon. The choice of inhaler, should I say, is just as important as the choice of drug. Your doctor will recommend certain medicines depending on how severe your lung disease is and also what symptoms you have. But it's important to be able to use your inhalers properly. Some people can use some types of inhalers better, whereas other people might prefer other inhalers. So the 4 different types of inhalers that we use are the pressurized meter dose inhalers, and they're used with or without a spacer device. Now, these would be your simple ones like the sprays where you push the top and out puffs the spray. And they can be used with big bubble-like chamber devices to help you be able to use them better. Breath-actuated meter dose inhalers, that would be the Easy Breathe inhaler, that's the most common one of those. Dry powder inhalers, that's like the Symbicort, the Seretide, the new Breeze inhaler. The soft mist inhaler is the last kind of inhaler that we use, and that's like the Spiriva Respimat inhaler. Now, nebulizers are handy, but they're generally only recommended when people are not able to use their inhalers, or when you're too unwell to be able to use your inhaler, or when high doses are required as well. Apart from the bronchodilators, we have the steroid inhalers. Now, I've mentioned a few here, Becotide, Flixotide and Pulmicort. Because there's combinations of drugs in inhalers, the Seretide and the Symbicort are the more well-known inhalers. So if you're using a Seretide inhaler, you're actually receiving the fluticasone. If you're on the Symbicort inhaler, you're receiving the budesonide. Now, in the past, they were always known as brown inhalers. They come in so many different colours now. They used to be called brown inhalers or preventers. They are what they say, they're preventers. They need to be used regularly. They don't work automatically when you feel breathless. And they work to reduce inflammation and secretions in the airways, and they can decrease the sensitivity of the airways to irritants and allergens. They're not suitable for everyone. They're not routinely just thrown into your inhaler mix. They might be used for people with moderate to severe COPD who have frequent exacerbations, because what they've been shown to do is possibly reduce the number and rate of exacerbations that you have. So that's the reason you might be on that. And generally they're only recommended in combination with one of the long-acting bronchodilators, beta agonist type. So again, these have different kinds of side effects. Oral thrush, sore throat, hoarseness, they're common and can be prevented by rinsing the mouth out with water afterwards or gargling with water afterwards. That will just wash away any residual steroid that may have impacted on the back of the throat. And if you're using one of the pressurized meter dose inhalers, again, they can be used with the big volumatic spacer device, and that would reduce the deposition of drug in the throat as well. Increasing thoughts now at the moment where they feel that the steroid inhalers can increase the chance of getting a pneumonia. So I'll talk about a couple of oral tablet or capsule forms of medicines. They're not as commonly used in COPD patients, but one is theophylline or aminophylline, that's the drug names, and certain brands of these tablets would be Uniphylline, Slowphylline, Newlin, Filocontin. They work in a different way to help open up the airways. They're used to prevent symptoms, so again, they have to be taken regularly at the same time of day. So they relax the muscle of the airways, allowing you to feel you're getting your breath more easily, and they can increase the lung clearance of mucus. One thing about these tablets, they're called prolonged release tablets, and therefore they're constantly releasing the drug as it's moving through your gastrointestinal tract, and you have to swallow them whole so that you're not interrupting that mechanism. They may be added in to your inhaler regimen if your symptoms aren't improving as well as your doctor feels they could. Nausea, vomiting, nervousness, tremor, sleep disturbance and headache. Actually, this kind of medicine has a lot of side effects, and there's actually a fine line between an effective dose without side effects and a dose which causes a lot of side effects. Sometimes your doctor may do blood tests shortly after starting this kind of medicine to make sure that you're on a dose that's suitable for you with the least chance of causing side effects. These medicines have a lot of interaction with other drugs as well, so some drugs may affect the levels in the body of this medicine, and it's important to know what medicines you're on. Make sure your pharmacist and doctor know all the medicines you're taking in case any of them are interacting, and that includes other medicines over the counter. Cigarette smoking can affect the way the drug is metabolised in the body too, so it might be important to let your doctor know if you've stopped smoking or started smoking when you're on this medicine. The other oral medicine that I'll talk about is Singular and Accolate. They're not really treatments for COPD, but sometimes COPD and asthma coexist, so if you've got an asthmatic element to your airways disease, they can be useful in addition to inhalers. This one also is working towards opening up the airways. They block the effect of kind of inflammatory chemicals called leukotrienes on the airways, which often cause chest tightness. The Singular is the most commonly used tablet in this group of tablets. It's used once daily in the evening, again every day, every night. The other one is Accolate, which is used twice a day, and it has to be taken on an empty stomach. Side effects of these are headache, nausea, diarrhea, abdominal pain and thirst. And it's important to note that if anybody's on this Singular or Accolate, to report symptoms like flu-like illness, increasing breathlessness, pins and needles, numbness of the limbs to your doctor, because very rarely it can cause systemic side effect that can be serious. I'm sure everyone who's had an exacerbation of COPD has been on delta-cortrol or prednisolone. It's a steroid tablet, and this is used when you have severe inflammation in the airways, so it's an anti-inflammatory medicine. It's usually given also to give your body a boost as well. It's under stress and you're just very unwell, so it just helps your body cope with that exacerbation. Usually you're taking 6 to 8 tablets initially. Your doctor will prescribe 6 to 8 tablets taken at the same time of day in the morning. We recommend taking them after breakfast because they may cause a wee bit of tummy upset, and you could be on them for any time between 7 and 14 days. The doctor might sometimes reduce down your tablets, so you might be on 6 one day, 5 the next, or after a couple of days you might be on 4, or sometimes the doctor will just stop them after the treatment length, and this depends very much on each individual, how many courses you've had recently and how long you've been on them. It's just very important to make sure you complete the course of these tablets and take them as directed, and not stop them suddenly without your doctor's knowledge. And your pharmacy should label the medicine clearly, how many to take on what days, but it might be useful just to keep a note of that yourself, just to make sure you're doing it as they've advised. The steroid tablets unfortunately have a lot of side effects. The most serious side effects usually happen if somebody's on these tablets long term. The stomach irritation and very rarely ulceration can occur. The irritation is usually, as I said, helped by taking them after food. Blood sugar problems can lead to diabetes, where your sugar levels in your blood is raised. Osteoporosis, where you've got weakening of the bones. Weight gain, possibly associated with an increased appetite and fluid retention. Insomnia, altered immune response, and a reduction in the body's ability to produce its natural steroid can also occur. If anybody's on this kind of tablet long term, it's usually a very small dose, but it's also important to have what we call a steroid card, just that would highlight to anybody, if you're ever brought into hospital, that you're on this steroid long term. Never stop taking it without your doctor's advice. Just moving on to antibiotics. Antibiotics are used to treat bacterial infections. When you have an infection, it causes further lung damage, so it just going round in circles. If you've got further lung damage, you've got worsening symptoms. Some exacerbations are not infective, but sometimes people with an exacerbation will be told they've got an infective exacerbation of COPD. With a lung condition like COPD, you're automatically more susceptible to getting chest infections. So what the idea of antibiotics are to kill the bugs responsible for the chest infection. Your GP would choose an antibiotic that's more likely to act against the bugs that are usually responsible for these types of infections. If it's very severe and you're in hospital, the antibiotic might be given into the vein through an intravenous drip. Otherwise, your GP may just start a week-long course of an antibiotic, at home. It's very, very important to make sure that you take the antibiotic the way it's recommended to be taken. Always complete the course, never stop halfway through because you're feeling better. If you don't complete the course, you may deteriorate again. Your infection may not be treated properly. By not killing off the bug properly, you're risking that bug becoming resistant to future courses of antibiotics. Penicillin allergy is fairly common, and other allergies as well to antibiotics can happen. So be very careful about what you're being given. Make sure your doctor knows of any allergies you've had in the past to any medicines. Side effects of antibiotics quite commonly are thrush, nausea, vomiting, stomach discomfort and diarrhoea. If you have any intolerable side effects to the tablets, don't just stop taking them. Go back to your doctor and see if there's an alternative available. Some people with COPD might take cough preparation. There are two main types of cough preparations. One type are the cough suppressants. What they do is suppress the cough reflex. They're supposed to be used for dry, irritating coughs. They're not generally suitable in COPD. These are the likes of codeine linctus or Benylin or any other brand which is for a dry cough. The reason they're not suitable is they suppress the cough reflex. With COPD, we want to encourage you to be able to, bring up the mucus that's lying there in the lungs. The other reason, they can also make the mucus more thick and it can be more difficult to bring up. Side effects can be drowsiness and respiratory depression, so that's not favourable for people who've got serious lung condition already. Now, the type that some people will take are the Exbutex or Pulmoclays. They're mucolytics and they help to break up the phlegm, the mucus in the lungs, and that makes it a lot easier to bring them up and to clear the secretions. They've been shown in some cases to reduce the frequency of having exacerbations too. One of the side effects is gastrointestinal irritation. So what it can do is interfere with the protective mucus layer in the stomach. So probably not a good idea if you've got an ulcer or a history of gastric ulcers, and rashes can sometimes happen too. I just wanted to talk briefly about vaccinations. Two vaccinations that you should have when you've got COPD: flu vaccine and the pneumococcal vaccine. Now, the flu vaccine helps to prevent viral influenza. It has to be given every year. It's usually October that the vaccines become available. They don't cause the flu. They're an inactive vaccine, which means it's impossible that the vaccine can give you the flu. The most common side effect is a sore arm, so it's well worth it to prevent the flu. The pneumococcal vaccination is vaccination against a bacterial type of pneumonia, and it's sometimes repeated every 5 years. Doesn't have to be given annually, but it's just important to know that these two vaccines are extremely important to help to reduce the chances of getting infections, and complications from these infections are a lot more serious in people with COPD. Just always know the names of your medicines, the dosage you're on and the times that you take your medicines, because it's so handy to have. If you come into hospital, we know exactly what you're on. Read the pharmacy labels and the product information leaflets to give as much information as you need to be able to use your medicines effectively. It gives you all the side effects, the warnings that you should know, and especially with the inhalers, it reminds you exactly how to take your inhaler properly. Report any side effects, especially if they're serious side effects such as rash, swelling, breathing difficulties, itching, hives, chest tightness. That's possibly an indication that you've got an allergy to the medicine you've been given, and make sure that you contact a doctor very quickly if any of these develop. Again, I've mentioned about using your inhalers correctly and at the right times. There's numerous people that you can speak to about how to use your inhalers. If you're in hospital, the staff nurses, pharmacists as well, and shops in the hospital. I'm sure your GP would be able to go over that with you as well. Never run out of medicine. Always order your medicines in advance of you running out. Always have a short supply, but store it safely. Never share medicines. Don't use somebody else's tablets because they may not be suitable for you. It may do you more harm than good. And just don't stop any medicine without your doctor's advice, because it may result in worsening of symptoms.